Welcome to the Elixir Sessions, where we explore the cutting edge of wellness and innovation. We're thrilled to welcome Dr. Jonathan Fields to the Elixir Sessions. A renowned integrative medicine practitioner, martial artist, visual artist, Dr. Fields brings a multidimensional approach to wellness. With expertise in acupuncture, functional medicine, herbs, and cutting-edge therapies, he helps patients transform their health and vitality. Dr. Fields, thanks for joining us today. We're excited to hear about your integrative approach to wellness and the incredible work you're doing. But first, can you tell us a little bit about your background?
My background is I'm a doctor of acupuncture and oriental medicine. Both my doctorate and master's are in herbal medicine, acupuncture, Eastern medicine. On top of that, I've been practicing functional medicine for about 9 years now. And we do stem cell therapies, PRP therapies. We have an anti-aging clinic where we do longevity as well. So we work with everything from serious chronic diseases like Parkinson's, MS, cancer, digestive issues, to things like shoulder pain, back pain, joint pain, and everything in between.
Where do you see the intersection between your practices and the psychedelic world?
Yeah, so I have a specialty in mental health. I'm actually the Southeast Director for the American Institute of Traditional Chinese Medicine and Mental Health. And we deal with a lot of anxiety, depression, stress, trauma. I'm actually a graduate of the Parkland High School where they had the incident a few years back, and I worked in the trauma center there for a couple of years that they built next to the school. I volunteered doing acupuncture, teaching Tai Chi classes there, teaching art classes there as well. So mental health's always been one of my priorities, and people come into us with everything from suicidal ideations to severe anxiety, treatment-resistant depression. And sometimes we do very good work. We have very good results with the acupuncture, with the herbal medicine, dietary changes, the functional medicine stuff, but sometimes it's not enough. And sometimes our patients have tried everything. They've already tried all the pharmacological options. They've tried talk therapy, EDMR, TMS, pretty much everything. And when there's nothing left, it's like, hey, well, we know these compounds are working. We have these clinical trials. We've seen that they're safe and effective. So I'm here to advocate for my patients, basically, and for patients all across the world, to have better access to these medicines that have been used for quite a long time.
Could you possibly share an example of how your patients have benefited from your approach?
We have quite a few patients that have had success with these kinds of things. We have one patient who actually, after 30 years of SSRI use, being on Lexapro and all these different drugs and not having good results and not feeling great, actually went on and did a psilocybin journey one time and stopped right there on the spot. It's been probably 6 months now and hadn't taken any medication since. I had another interesting case where a patient of mine brought her son to me, and he was a young 20-something-year-old kid in college, severe anxiety, could barely get out of the room, wasn't working, talking about suicide, and they had tried everything. They had tried, all the things we spoke about, and even with our therapies, it wasn't working, and I just wasn't able to get the compliance because of the anxieties and because of the schedule to get them in. So I referred them out to a ketamine clinic, and they did 6 sessions of ketamine with psychotherapy, and they did, I think, 1 or 2 more treatments over the next year period. It's been over 2 years now. The kid has no suicidal ideations. He's in school. He has a job, 0 medications. So we've seen these kind of incredible results, and we just want to let people know that this is possible, this is out there. And if you look at the efficacy rates, some of these psychedelics, the efficacy rates are much higher than the pharmacological options or talk therapy alone, or even the combination of both.
Do you have a favorite modality that you've worked with?
I do dabble in a lot of modalities, and my background and most of my training is the acupuncture, the herbal medicine, and teaching Tai Chi, Qigong. I'm a martial artist. That's what got me into the Eastern medicine. I've been a martial arts my whole life. I taught professionally for 15 years, working with professional fighters and everything from special needs kids to first responders and all that. So I think anytime I can incorporate any of that, some of the body, mind, spirit exercises into the treatment plans, whether it just be some breath work or some very simple guided meditations or, dietary lifestyle advice, things that come from the Eastern realm have been proven to work, without all the clinical studies, without all the drugs. I mean, some of this stuff's been working for thousands of years, and we actually have documentation and books going back 2,000 something years, talking about very specific types of people and the constitutions and different elements of people. So it's a completely different philosophy. And I think the very fun part for me is to try to kind of mix that East and West and try to explain it to somebody in a way that makes sense without having the cultural context to understand a whole different, culture.
So what role does Tai Chi play in fostering the mind-body-spirit connection?
It's super cool because, they're all kind of related. And in the Eastern medicine or in any sort of holistic medicine, even in a functional medicine, a lot of those carried over, there's always the focus on the mind, body, spirit. And I think on the Western side, we kind of separate that. We're like, oh, you take this drug for this, or you go to the gym, your body's fine, you should be healthy, right? But you can't take out the mind, you can't take out the spirit. It can only last so long, right? If anytime that you're doing that, eventually your body's going to break down as well, right? Or so, part of it is we're working everything from, stress management to diet, lifestyle, hydration. You'd be surprised. And some of the stuff is very basic chemistry, very basic, biomedical science that a lot of doctors just kind of glaze over. You'd be surprised how many people come in and they literally do not drink any water, like zero, right? And they're chronically sick. And sometimes even doctors and nurses come in as patients and they have these issues. And like, this is some of it you would think would be common sense, but I guess it's not being taught in medical school, or they're just always looking for the medication or the surgery. And we just a lot of it is just simplifying and stepping back and kind of looking for what your body's asking for. So like, if you're the type of person that's always hot, well, try cooling herbs, try cooling foods. If you're the type of person who's always cold, have warm spices, have ginger, have cinnamon. These things, they'll make your body feel better. So a lot of it, I think, is just going back to our roots and listening to us and taking responsibility and accountability for our mind, body, and spirit, rather than putting it in the hands. The doctor said, take this, I'll be fine, right? That's often not true. So I think just getting people to be aware of these issues and aware of what's going on in the mind and the spirit outside of just the body alone is what helps kind of unify the three. And then within the Tai Chi and the Qigong exercise, we have specific meditations and focuses and breathing into our different energy centers, which allows us to align the three. And posture is a big one, right? We're meant to have an erect spine. So if you're sitting at a desk all day, all hunched over, you're not going to have a healthy mind, body, and spirit, right? You don't have that alignment. So the energy from the heaven and the earth cannot flow through you and meet in the middle and kind of flow freely throughout the body. You're going to create blockages and stagnation, especially from sitting all day, right? That's one of the things, we talk about sitting being the new smoking, right? It damages your kidneys, damages your back, your spine, your leg muscles. It creates all these imbalances, which will also damage, your spirit. Same thing as like, we're on our phones all day doing this, right? What do you think that's doing? Oxygen delivery to your brain, right? If you're not getting good oxygen delivery to your brain, you're going to cause some serious damage, not to mention what it's going to do to the spine and everything else. And then you're increasing your risk for, strokes and heart attacks and all these issues. So some of these things are very basic. We were not designed for this. Kids were not designed to sit for 8 hours a day at desks. They don't need drugs. I think that's one of the biggest scourges on our society is drugging all these kids. Every other kid, oh, my kid needs ADD drug, ADHD. No, they need a good diet. They need to eat real food, and they need to be active. They need to be engaged in learning, not just sitting and listening.
How do you see therapies like acupuncture connecting the mind, body, and spirit?
We want to talk a little bit about how acupuncture works, right? There's the traditional Eastern model, and then there's the biophysiological explanation of it, right? From the East, we're moving blood, we're moving chi, we're clearing up blockages of energy or stagnation of blood, blood clots or muscle adhesions. If there's places where you have pain, sometimes we can actually unbind muscle fibers to allow fresh circulation to come there and heals it. But essentially what the acupuncture is doing from the bio model is you're tricking the body into healing itself, right? Just like if you had a cut, it scabs and then it heals, right? So the scabs clotting factor has growth hormone in it. So you're inducing the body innate immune system to heal itself, right? When you get a cut, basically the body knows, oh, something's going on there. So send some fresh blood there, send some cytokines, some growth factors, all these anti-inflammatory molecules that we have in our system anyway, they get triggered. On top of that, every time a needle enters a certain point, you're triggering the nervous system. And then the brain is saying, oh, what's going on here? there's something going on. You need to go fix that, right? The other thing that happens is they've done in functional MRI studies, and they've shown that you're releasing endorphins. So every time you're getting acupuncture or you're doing any of these, whether it be massage or any sort of hands-on therapy, you're releasing serotonin and dopamine and oxytocin. So these are basically opioids that your body makes on its own. So they're going to help with pain. They're going to make you feel good, and they're going to help you kind of forget about some of these other troubles or struggles you're having. So it's a combination of increasing circulation, stimulating the nervous system, and an endorphin release. That's the bio model. And then on top of that, you can look at it from the traditional Eastern model. Every point has different functions. Every point in the body, every acupuncture point, there's about 400 common ones that we use. Then there's all sorts of microsystems and auricular ear systems and scalp acupuncture. But the points actually have sometimes 3, 4, 5 different functions. They're in different channels and different meridians. Some of that doesn't have a biological one-to-one where we can't see the channels. So some people argue, hey, they don't exist. But the truth is the channels or the meridians that we use in acupuncture are actually the space in between tissue. So it's not a physical structure. It's a space in between tissue that you're going to have things like nitric oxide flowing